All right, I'm gonna see if I can get through this now without the constant interruption of my phone going off. We'll see if that will work. All right, so hopefully this will give you more than what I was just threw files up on the labs. Then maybe this will make more sense. The actual files you're gonna be tested from. So it kind of looks like we're gonna be doing quizzes and exams on Blackboard for a while. You'll need to know the teeth. They're coming from the model skull that we have in the labs. So right up front, the incisors. Just beside those, the canines, a little more sharp. I'm not asking you premolars at all. The molars are in the back. They're for mashing. Right? Canines, I don't like this picture very well because it's kind of hard to see. But if you see something like this with fangs, those are canines. If I ask you for this, name the specific tooth. You'll need to know the parts of the tooth. So the outermost portion is the enamel. Just beneath that is the dentin. And then the inside you have the pulp or pulp cavity. Not asking for crown or root, just these three layers. And you will see this picture again on either the quiz or the exam or both. So get to know that, the enamel outside the dentin here, the pulp cavity in the middle. This is a molar. Probably want to ask you like that. I want you to see all the teeth together so you can make a determination which tooth it is. All right, you'll need to know these salivary glands. Some of these will come from the half head model we have in lab. So just anterior to the ear is the parotid gland. You don't need to write parotid salivary gland, but it's still correct if you do. So the parotid gland. The mandible would be here. So just beneath the mandible, you have the submandibular gland. And if I point underneath the tongue of anything and ask you to identify the gland, that's the sublingual gland. So just remember, ling means tongue. So sublingual is just beneath the tongue. You need to know the regions of the stomach, probably from one of the stomach models we have in the lab. So the esophagus would be here. So this first little portion here is the cardia. And I'm going to ask you to identify the region for these. This heaped up section here is the fundus. All of this middle part here is the body. I'm not going to ask you for antrum. So if I ask you to identify this region, the entire thing is the pylorus. The antrum is technically part of the pylorus. All right. I don't know why the features are on here, but they are. So if I ask this inside curvature there, lesser curvature, and the larger side, the greater curvature. All right. You need to know the musculature coming from the model we have in the lab. And the model we have in the lab has this section cut out of it to show you the deeper muscles. So the most superficial muscle, longitudinal. And you'll see it running long ways. The circular muscle fibers will run circular around the stomach, and then that cutout section on the model will be the oblique layer that runs diagonal. If I ask you for the feature, this wavy stuff on the inside, that's the rugae. Right? Again, the structure here, the pyloric sphincter, this becomes duodenum. It doesn't show it here, but there's a sphincter here that's either cardiac sphincter or lower esophageal sphincter. They're both correct. Take your pick. All right, from there we get into the sections of the small intestine. So the pyloric sphincter would be here. So this is duodenum, jejunum, and then ileum. You need to know the portions or the specific region of the small intestines in order: duodenum, jejunum, ileum. We'll get to that in a second. So you see here color-coded for you so you can kind of see the way that works. I'm going to make it really obvious. There may even be a picture just like this or a picture very similar to it. And then I'll ask you from somewhere in the middle of these. If it's more confusing, then the duodenum is up here close to the stomach. The ileum is close to the cecum, and then the jejunum is kind of somewhere in the middle there. But the small intestines running from pyloric sphincter to ileocecal valve or ileocecal sphincter, which will dump into the large intestines. This first part here, but the cecum, we're going to see in a second. Oops. The feature of the small intestines, we'll see better from the model in a moment here. Plicae circulares. If you don't want to try to spell that, then you can just call them circular folds because that is a correct term also. All right, then we'll see the end of the small intestines where it's emptying into the cecum at the ileocecal valve or the ileocecal junction, the little kissy lips. All right, so we've dumped into the cecum now. So this entire thing is the large intestines or the colon. I'll ask you to identify these specific portions as well. The first portion is cecum. This feature is the appendix. So this specific portion here is the ascending colon. This specific portion, transverse colon. This one, descending colon. Sigmoid makes a little S turn shape. And then the rectum is the storage area, and then the anus. These little pouches out here that we'll see better in just a moment, that's a feature. That's the haustra. And the line, this feature would be the Tenea coli. All right, and get a better look at it here. There's your Tenea coli. Once again, there's the spelling. Again, just get close. You'll be okay. All right, and an even better look, someone with their small intestines back here not having a great day. But you can see the Tenea coli, that strip there, and then the pouches there, the haustra. This isn't on the exam. I don't know why it's here. I don't know why this person is wearing gloves. It's really disgusting. It's definitely not me because my cuticles look better than that. Let's go on. Greater omentum. The cats are deteriorating, so this is going to be kind of difficult to see on them. This is hanging from the transverse colon. just a drape of fat where we store nutrients, you may get a picture exactly like this. Remember greater omentum. We don't need to know the lesser omentum right now. Now, there's your mesentery again. Again, somebody not wearing gloves. What's wrong with people? Right, you need to know the lobes of the liver. So if you're looking straight at someone here, this is their right lobe. Remember, patient's perspective. Right lobe's larger, left lobe's a bit smaller, separated by this feature, the falciform ligament. So I ask you to identify the lobe feature. We flip the liver over. There's your gallbladder there. This lobe right beside the gallbladder has 4 distinct sides. So that's the quadrate lobe. Quad means 4. Gosh, can't talk. So flip back this way from the top, this inferior vena cava, and this weird shaped lobe there is the caudate lobe. If we're going from quadrate with 4 distinct sides, the caudate kind of sloped, weird shape. So those lobes, moving on here, you'll probably get it just like this from this model. So remember lobe feature. Again with your lobes. See, my cuticles do look better. Gallbladder again for the structure. I'm not going to ask this portal circulation right now. You'll get to that a little bit later. Need to know the bowel circulation, not from this hideous picture, but maybe from this picture, almost definitely from this model. Remember, hepatic means liver. So we're going to have patient's perspective, the right hepatic duct, left hepatic duct. The two of those come together to make up the common hepatic duct. The gallbladder in medicine is called the cholecyst. So if you remove one, it's called a cholecystectomy. Cholecyst, chole means fat, cyst means bladder. So this is a fat bladder storing the bowel. I'll tell you all that because of this duct here, the cystic duct. So now you know cyst means bladder. This is the duct that's emptying the bladder. All right, all of this comes together to make the common bowel duct. All right, here we have the pancreas. The stomach's been removed. This is the pancreatic duct, the head, body, and tail of the pancreas. These two come together here to make up the hepatopancreatic duct, which will dump into the duodenum. And you'll see the feature here, the little lines. That feature is plicae circularis or circular folds. All right, already went over all that. Here we have a very bad picture of a pancreas. I'll probably use the picture we used earlier in the semester. But you remember your islets of Langerhans are pancreatic islets. I remember inside of those, the alpha cells secrete glucagon to increase blood sugar. Beta cells secrete insulin to decrease blood sugar. The Acini or the Acini cells are producing some digestive enzymes and mainly bicarbonate. May not ask the stratified cuboidal epithelium. That's mainly found in the salivary gland ducts. This picture and this picture is setting you up for these microscope slides. I don't like this one as much as I like this. For this, we're looking at a portion of the liver. All these little black, purple spots are all the hepatocytes, the liver cells. The sinusoids I'm not going to ask because it'll be difficult to figure out, but I will ask central vein and hepatocytes. And you can click and see all of that there, right? You see this big weird thing with puffy cells and little spaces in between. This is probably the exact picture you're going to see, actually. So the arrow pointing at open space, that's a gastric pit. Probably doesn't make sense at this point in the lab stuff, but it will make much more sense in lecture. All right, but this is the small intestines. You see the villi up here is the lumen. These are the simple columnar cells that we learned last semester that are absorbing nutrients. I'm not going to ask that again, but I will ask you this specific region. This is the mucosa. Attached to this specific region, submucosa, and then the muscularis externa, but you need to know more than just muscularis externa, and that's why I have this picture. So you need to know that the inner layer is circular, the outer layer is longitudinal. I'm not asking adventitia. All right, well, there we are right now. So hopefully this is going to help out better than just throwing files up there. Probably gonna do the same for lecture because it seems to work a little bit better. I hope we'll see for sure pretty soon. Naturally, if you have any questions at all, please let me know. And in between these patients, I will help you out.